Okay, this is a prequel video on invasive cervical cancer. So before knowing about it, we should know some of the terms which helps in understanding it clearly. So we will know about squamous intraepithelial lesion and cervical intraepithelial neoplasia in this video. So first, dysplasia means is a typical cytological change in the layers of the epithelium, mainly stratified squamous epithelium. We have a thick epithelium and whenever there is an atypical change, it is called as dysplasia. There are mild dysplasia, moderate dysplasia, and severe dysplasia. In mild dysplasia, there is only about superficial layers involvement, whereas in severe dysplasia there is complete involvement of the thickness of the epithelium. And after severe dysplasia we have carcinoma in situ, which next leads to invasive cervical cancer. And carcinoma in situ means full thickness dysplasia, that is carcinoma confined to layers above the basement membrane. If we consider this is the basement membrane, we have epithelium up to here, then there is involvement of complete epithelial layer above the basement membrane. Okay, and coming to cervical intraepithelial neoplasia, that is CIN, it is a classification based on the dysplasia of the epithelium of the cervix. Okay, based on the dysplasia we are classifying into grade 1, that of cervical intraepithelial neoplasia, and grade 2, grade 3. In grade 1, that is CIN1, the dysplasia is involved less than 1/3 thickness of the epithelium. So it is called as mild dysplasia. And next in CIN2, that is grade 2, from 1/3 thickness to 2/3 thickness involvement of the epithelium is seen. It is of moderate dysplasia. And in grade 3, full thickness involvement, or it is also equivalent to carcinoma in situ, that is grade 3 CIN, that is cervical intraepithelial neoplasia. So this classification is now it is changed into squamous epithelial lesion, that is based on Bethesda system. This is the new system. So now this system is followed. Actually, squamous intraepithelial lesion and cervical intraepithelial neoplasia are almost the same terms. Okay, and this system includes the HPV infection that is involved, that is human papilloma virus infection type. So it is mainly divided into two grades, that is low grade SIL and high grade SIL. Low grade SIL means which corresponds to CIN1, that is mild dysplasia, and human papilloma virus 6 and 11 infection, that is low grade SIL. You remember CIN1 means which involves less than 1/3 thickness of the epithelium, that is mild dysplasia. In high grade SIL, that is HSIL, which corresponds to CIN2 and 3, which means there is in 2 there is about 1/3 to 2/3 involvement, and 3 we have full thickness involvement. So it includes moderate and carcinoma in situ. Moderate dysplasia and carcinoma in situ, which involves HPV infection 16 and 18. So which can progress to invasive cervical cancer. Okay. Now the conclusion of this video is high grade SIL, that is corresponds to CIN2 and 3, that is cervical intraepithelial neoplasia 2 and 3, which includes moderate dysplasia, that is 1/3 to full thickness of neoplasia, and also carcinoma in situ, which means full thickness, and HPV infection 16 and 18 can cause invasive cervical cancer in about 2 years. Okay, in next video we will see clearly about invasive cervical cancer.